COVID-19 testing methods by Graham Hadley MD. While the COVID-19 virus enters the endemic stage, people still seek information on how to protect themselves from the virus. One crucial question is how people are being tested for COVID-19. In this blog post by Graham Hadley MD, we will explore the different methods used for COVID-19 testing. Ultimately, we hope to provide readers with information to help them make an informed decision about whether or not to get tested for COVID-19. Graham Hadley MD's Guide on Testing Method for COVID-19. Nasopharyngeal swab. A nasopharyngeal swab, NPS, is a COVID-19 testing method that collects a sample from the back of the nose and throat. This method is also sometimes called a nasopharyngeal swab or NP swab. The NPS is considered one of the most accurate COVID-19 testing methods available. This is because the NPS can collect a large enough sample to detect the presence of the virus. The NPS is also less invasive than other COVID-19 testing methods, such as the bronchoalveolar lavage, BAL. The NPS can be performed by a healthcare provider in a healthcare setting or at home using a self-collected kit. The sample collected by the NPS is then sent to a laboratory for testing. Results from an NPS are usually available within 24 to 48 hours. Nasal swab. Nasal swabbing is a standard COVID-19 testing method. The test involves inserting a swab, usually a long cotton swab, about an inch into the nostril and then rotating it for about 15 seconds. The swab is then placed in a vial of transport media for testing. Nasal swabbing is less invasive than other COVID-19 testing methods, such as nasopharyngeal swabbing, which involves inserting the swab through the nose and into the throat, and it can be performed without the use of personal protective equipment, PPE. However, nasal swabbing is not as effective at detecting COVID-19 as nasopharyngeal swabbing, and it is more likely to generate false negative results. According to Graham Hadley MD, nasal swabbing should only be used for COVID-19 testing if nasopharyngeal swabbing is not an option. Saliva method. This method works by collecting a saliva sample from the person being tested. The sample is then sent to a laboratory for analysis. The advantage of this method is that it is less invasive than other COVID testing methods, such as nasal swabs. In addition, it does not require personal protective equipment, PPE, which makes it easier to administer. The downside of this method is that it is still in the early stages of development and has not yet been approved for use by the FDA. However, researchers are hopeful that it will be available for use shortly. According to Graham Hadley MD's research, other COVID testing methods, such as nasal swabs, remain the most reliable way to test for the virus. Graham Hadley MD's concluding thoughts. Graham Hadley MD's article provides an in-depth look at the different methods for testing for COVID-19. We all must understand these methods to make informed decisions about our health and well-being. Please share this article with your friends and family, and check out our other resources on COVID-19. Thanks for watching.